It's great to be with you, although obviously not in person, but I hope that everybody is enjoying meeting up after not seeing people for a long time, and I'm certainly looking forward to doing that myself. I was going to be joined today by Dr. Sarah Bates, but I'm sure it'll be no surprise that our units are very busy at the moment, and paediatrics and neonatal intensive care particularly busy, so Sarah hasn't been able to get away. But I'm joined by Ellie, who knows a lot about the programme, so can answer any questions that I can't for the Q&A. So I'm going to be talking about PERIPrem, which is the Perinatal Excellence in Reducing Preterm Injury. And the reason for PERIPrem is very obvious. Being born very early is the leading cause of cerebral palsy and child mortality, and the aims of PERIPrem are to reduce harm and to improve outcomes. So we started in the west of England with the Academic Health Science Network, first of all taking on this as a project because we thought it was a fantastic project to do evidence into practice. And we had discussions with Sarah Bates and Professor Karen Leut, who really had the vision for taking this forward. And so we've been supporting them and talking with our colleagues in the Southwest. The Southwest Academic Health Science Network also joined us, and the Southwest Operation Delivery Network. So it became a collaboration of networks and systems. And really importantly, our parent partners have been absolutely key in co-producing and being really along the journey the whole way. So we used QI methodology and coaching during this project, which you'll hear a little bit more about. Essentially, it's a bundle of 11 different elements aimed at reducing brain injury. And the beauty of the PERIPrem Care Bundle is that it can be adopted and spread. So it's something that people can have access to. And as you can see, we adopted it across a whole region. So that's the whole of the Southwest. And it's been very successful in that respect. So PERIPrem aligns with national policy, the NHS long-term plan to reduce newborn brain injury and death by 25% by 2020 and by 50% by 2025. And it's a key ambition in the Neonatal Safety Improvement Programme, which the Academic Health Science Networks are supporting across the country. This is PERIPrem on a page. It shows you here all the different elements, some which will be very familiar to you, that you already have been using in units for some time, like antenatal steroids and magnesium sulfate. Others are newer, the prophylactic hydrocortisone and probiotics, but something there for really making sure that we apply everything that we possibly can to maximise the opportunity for a preterm baby to be able to have the best outcomes. And so our aim was to get 70% of mothers and babies to receive all eligible interventions, and that is a very tall ask, which we're still aiming for. But what we have seen is an improvement in each of the different elements. Just to show now how this aligns to the National Best Practice Programme. So the PERIPrem Care Bundle, obviously, we're talking about along the top there. The BAPM Toolkit, which was published in October 2020, the British Association of Perinatal Medicine. We worked with them to help to produce their toolkit. And as you can see, they have many of the elements that are also included in the care bundle, as does the national programme. It's described here as the MapNeo SIP bundle. Also in Saving Babies' Lives, magnesium sulfate in place of birth, and the Maternity Incentive Scheme, CNST scheme, is a requirement that trusts are ensuring that these elements are implemented. I'm just going to show a short animation now because it really does beautifully describe what PERIPrem does. It's about 5 minutes and then I'll come back to talking.
All over the Southwest, obstetricians, midwives, neonatologists and neonatal nurses have joined forces to revolutionise outcomes for the smallest and the earliest preterm babies in the largest regional perinatal quality improvements collaborative. Supported by the West and Southwest of England academic health science networks, PERIPrem is championed by Professor Karen Leut and Dr. Sarah Bates, neonatologists who share a vision and a passion for reducing brain injury and death for preterm babies. Together we have worked side by side with the Southwest Operational Delivery Network in true collaboration. PERIPrem has brought together clinicians, patient partners and quality improvement specialists to embed innovation and rapidly bridge the translational gap between evidence-based perinatal interventions and points of care. We want to grow strong perinatal teams at unit level and across the region. The result is a groundbreaking perinatal bundle of 11 evidence-based interventions that optimise outcomes for the earliest and most vulnerable babies, increasing their chances of leading fuller, healthier lives. Whilst a number of these elements were standard practice, for instance antenatal steroids, there was variability in uptake of all the elements across the region. We introduced newer interventions such as prophylactic hydrocortisone and improved performance of existing practice such as optimal cord management.
PERIPrem seeks to reduce this variability across the region and by increasing optimisation compliance, elevate the Southwest as a centre of perinatal preterm excellence. We have introduced both a PERIPrem clinical and a parent-held passport that ensures that care is standardised across the region, regardless of transfer in utero or after birth. It has created a new vocabulary for clinical teams and unified perinatal working. This collaborative optimisation is beautifully demonstrated by the transfer of a mother between 3 PERIPrem units.
I had heard from the obstetric team that we had a mother transferred in utero to us in Swindon for delivery of her twins because one of her babies had stopped growing and was running into trouble. I knew she'd had a complicated pregnancy and that she'd been transferred from Yeovil to St Michael's, but that things had worsened for the small twin and they needed to be delivered. St Michael's was full and we were able to help out with capacity, so we accepted her to Swindon. I went to meet her to talk to her and her partner about the planned preterm delivery. I remember she was understandably emotional and worried. She said she'd lost a baby before. She was so frightened that her twins might not survive, and she asked me to do everything I could to save them. So I began to explain about all the different things that we could do and would do to help her baby survive with the very best outcomes. And she said, "Do you mean PERIPrem?" They told me all about that in Yeovil. A lovely midwife had sat with her and explained all about PERIPrem and how it would help her baby survive and lower their risk of brain injury. She also said that the midwife had told her all about how important her breast milk would be for her babies and how she could express to help. She also said that she'd been given the PERIPrem leaflet and that they had read it. She was then also able to explain how St Michael's had continued the PERIPrem pathway. They had given her steroids and they'd moved her to the correct place of birth with the right maternity and cot capacity. In Swindon, our midwives had already supported her to express some breast milk just before her planned delivery, so each baby already had 1 ml of maternal breast milk available before they were born. I began to explain about optimisation at delivery, but she'd already been so well informed that she knew to ask me about deferred cord clamping and normothermia, and it was just so amazing to see patient engagement and experience with PERIPrem being delivered at a regional level. Both babies received deferred cord clamping and the full PERIPrem package. Both babies have done so well with normal head scans so far.
The full record of the interventions this mother and her babies received, including whether they were optimally timed, is entered into the PERIPrem optimisation tool, where it can be reviewed to identify where improvements can be made. PERIPrem has made incredible waves. We have created a perinatal network of quality improvement excellence and take great pride in the vibrant and committed perinatal clinical community that has arisen. We have improved our clinical practices, and we will continue to work together to protect the smallest babies so that they can lead the biggest lives. Well, I'm really pleased I was able to show that animation because you heard Sarah's voice, even though she hasn't been able to join us in person. And you also heard Professor Karen Leut describing really essentially what PERIPrem is. So when we set out to launch PERIPrem back at the sort of early 2020, our aim was to make sure that we had the regional commitment, really facilitate a perinatal clinical QI collaborative. It was about bringing together perinatal teams to work together and share ideas and bring networks across the West and Southwest and have that sort of regional approach with standardized tools in order to help to deliver the project. So at that point, we were about to bring everybody together. We had hotels booked. We were going to be face to face. We were going to have a big launch. And then, of course, as everybody knows, we had a pandemic and that threw everything completely. And it was very difficult at that time, not knowing how that would develop and how that would impact on other than essential work. So we did think that this maybe could have stopped the project at that point. So we asked all the teams in all the units what they wanted to do. Did they want to go ahead with PERIPrem, or was it too difficult at the moment and we could wait until later after the pandemic? But obviously we didn't know then what we know now. But the unanimous response was no, we want to carry on. We want to do it because it's really important to us that we have something really positive like this to focus on. So we put all our resources online very, very quickly. And I think as many people found during the pandemic that things that previously had taken a long time to do, we were able to do them quite speedily. So we did videos, we put together toolkits, infographics, and put them all there online, and then turned all of our launch into online events, and really continued that with online sharing events right the way through the project. So I can't emphasize enough how much this has been parent and perinatal team focused. It is really, we're talking about it, but it really, the involvement of the parents and how they helped us to develop this, and the involvement of the perinatal teams and the commitment that they showed has just been amazing. And it really is down to all of them that we've been able to continue and have success with the project. And I think it was a great way of bringing perinatal teams together to work together on one project. So also, of course, we needed to make sure that we were demonstrating that the project was bringing about improvement. So there was a lot of data collection. We have a PERIPrem perinatal passport for clinicians as well, which they complete to identify that mothers and babies have had each element that is appropriate to them. And that is then recorded and collected. The data is collected monthly on a tool so that we can see exactly what numbers are having the interventions, what numbers are having the care bundle. And really, it gave us the opportunity to see where things perhaps weren't moving as fast in some areas, and to see where we might need to target and perhaps focus some of our share and learn sessions, particularly in one area or another. So we were really lucky that we had some brilliant expert speakers that expert clinicians, obstetricians, neonatologists, people who have an expertise in human factors and safety culture, and of course our committed parents. So this is just an example of one of our units in Exeter and how they would do their return, so that each month they could see the progress that they've been making. And many of them would then put this up in the unit to act as encouragement and really inform the staff. So really getting that involvement of everybody in the project. And then we would collate all of that so that we could see what the trend was. We could do that by bringing all of the units together or select a unit. And you can see there, I mean, already, we've got antenatal steroids in the 90s, but something that people weren't perhaps as used to doing, like probiotics or delayed cord clamping, that was not going to be, we didn't expect that to be hitting the high numbers, but actually you can see there was quite a change from the baseline. So we were able to keep an eye on, we still do that as part of the optimization ambition for the MAP-NEO Safety Improvement Programme. So just some examples here, we had lots to celebrate. Early maternal breast milk has been one of the successes, and I think learning for not just for clinicians, but also for mothers, how important early maternal breast milk can be. And it doesn't have to mean for a baby to breastfeed, but that you can do buccal colostrum, give buccal colostrum, and that makes such a difference to a premature baby. And that's something I think the parents particularly feeling that they are actually really contributing to the for the benefit of their own baby. Optimal cord management is another. I'm not sure if you can completely see the chart because I think my face might be in the way, so apologies for that. But we've had some good progress with deferred cord clamping, as it was called, optimal cord management. And that's really been where the perinatal teams have worked brilliantly together to make that happen. As again, probiotics, we've seen improvements. Place of birth is very variable still, and that is probably because it's just a much more complex, making sure that babies are born in the right place. It depends on the availability of a NICU cot, but also of a maternity bed as well. And when you're challenged by geographical distances, and you've got dedicated neonatal intensive care units in usually in urban areas, then that causes more of a challenge. So in terms of where we're going, we feel overall our trends are going in the right direction. This shows the numbers of where the mother and baby received all of the eligible interventions for that particular mother baby dyad. So we obviously are slowly improving that, but the improvements so far, because they have been in individual elements, it's only when we get all of those elements right that we'll see that increasing. So we've certainly that's something that we're working on very closely with our regional partners as well. So the progress so far. This is a graphic that just shows where we've come from, the numbers of babies that have been cared for under PERIPrem. The Southwest is a population about the size of New Zealand, so it shows us the sort of the enormity in a way of just one region of England taking on a project like this. So I talked about place of birth, and that really, as I said, is down to availability, cot finding and capacity, and requires that multi-system effort. So we are working, we have got a Southwest Regional Working Group working with the Maternity Clinical Network and the Neonatal Operation Delivery Network, and we're looking at some of the solutions, possibly at the moment exploring app-based technology for cot locators, and continuing to use the QUIP app, and very importantly, improving and recognising signs of preterm labour for women to have that information so that they get care early. As I said, the parent partner co-production has been brilliant, and we still they are both Leanna and Amy still working with us, and they've run some of the share and learn sessions as well. So, and at unit level, fantastic enthusiasm and ideas that just coming up, you know, how to solve problems people came across, you know, how could you facilitate delayed cord clamping when the tubing didn't stretch, so, you know, longer tubing, you know, solutions that people worked out to be able to, you know, sort of really make sure that the optimum was delivered wherever possible. And these are some of the ideas and the notice boards that people used in their unit to encourage. So the keys to that success are here. I think I've talked about all of these, and we had a celebration event because I think it's really important celebrating with people when things have gone well, and we can look at how we can keep improving, but it's great to celebrate. And Anna Gayer, who's a graphic illustrator, joined us and did this lovely illustration. Some of you will have seen Anna Gayer's work because she works a lot with Who's Shoes. So everybody got to have one of these, and they can have them up in their unit. Very positively received by staff and by parents, as I said, and has really sort of focused on quality improvement. So I'm going to end now with a very short film, but I think it's really important that you hear how this has impacted and what the parent experience has been.
Being a mother is just something I've always wanted. There's a lot of information out there, and you talk to friends that have children and they give you their views on what it's like to be a mother, but when it comes down to it, you actually have no idea.
I was scared, nervous, anxious, confused.
Things went quite badly wrong at 29 weeks.
Nothing could have prepared me for actually how terrifying those moments were.
A lot of Googling on our phones, you know, survival rates, health issues.
Everything just went out the window. Everything we'd thought we were going to have and how we thought it was going to happen. We were just completely out of control.
I remember receiving the PERIPrem passport quite early on.
That's when the PERIPrem care started right from the start.
It was really helpful to just kind of have it laid out on the table. Here's what's happening and why.
But I remember looking at it and referring to it, and I could see here, I don't know if you can see, that it's broken down into the relevant sections.
It was nice because it prepared us for what we were inevitably going to see.
The things that we were aware of straight away was they explained around the steroids.
I started on magnesium sulfate, which also was to help treat my preeclampsia, and at that point my midwife helped me to hand express some colostrum ready for Georgia when she was born.
I remember someone telling me about the plastic bag to keep them warm.
The complete package with the parent passport and the clinical passport is just, it's excellent.
All these interventions are here to help your baby and you.
What does PERIPrem mean to us? Well, saved our daughter's life.
Yeah.
Knowing the PERIPrem bundle was being used really helped us feel confident and supported.
Everything that was outlined in the bundle that just helped show how closely all these different members of the team are working together to do everything they can to help your babies. And I think it's just absolutely incredible. Thank you so much.
Sorry, I wasn't going to show it again. Yeah, from Sarah and myself, we would love it if you got in touch if you want more information. Yes, just that's neatly brought us to the end with the parent speaking. Thank you.
Fabulous, thank you. And I'm sure Cardiff are all cheering. I'm told that when I do that, they do clap. And that's great. We don't get to hear it, sadly, but be aware, people will be glad, because that was really excellent. It's really very such positive bundle, or no bundle project. I mean, is it a project that's just going to continue? What happens at the end?
It very much, because in effect, as a project, it did end as a project in April this year, but it's just we've transferred it into the optimization of care for preterm babies, which is part of the Maternity and Neonatal Safety Improvement Programme. We just call it PERIPrem still, but it's essentially the only difference is that the national programme has 7 elements, and we decided to stick with the 11 because we'd started on that journey for particular reasons that we'd included all those 11 elements. And the perinatal teams wanted to carry on, and they identify with PERIPrem. So that's what it is. So it just continues.
And so presumably all the data is still being gathered. So every month you know exactly what care and standard the mothers and babies have had over that period.
Yeah, absolutely. I don't know, Ellie, do you want to come in on the data question?
Yeah, we are really grateful for the continued support of all 12 units in the Southwest. They are still submitting data to us, and it's incredibly rich data because we can cut it across each of the individual interventions. We can individualise it for then the units in terms of optimisation of care across the pathway, and the optimization tool stratifies for gestational age, type of delivery, that kind of thing. So we can see it's about what appropriate interventions were given. So the denominator is always accurate for the units as well. So it's just been very, very helpful. And then we can cut it for our regions and then for the whole of the Southwest as in the total geography across 12 units. So it is really powerful. It does show us where there are absolutely opportunities to celebrate. So we've introduced 2 new medications for neonates in terms of, probiotics and prophylactic hydrocortisone for the very, very tiny babies. And it's just been like the rate and pace of introducing that evidence into practice has just been phenomenal. And we are just so grateful for the units for being so willing and open to that, but we've got the data to show that it's working. So, the celebration of success is pretty easy because the data tells the story.
So I mean, on that issue, will the data just continue to be gathered? Because sooner or later, I guess, well, it either becomes just custom and practice that everyone does and uses, like local audit, or part of a bigger thing. I wasn't quite sure.
Yeah, we are. So we are really strongly encouraging the units to take the ownership of that and then share it with their quality teams and, with their trusts and the local maternity and neonatal systems. However, because the Maternity and Neonatal Safety Improvement Programme, it has aligned very fortuitously to our ambition in PERIPrem. The national team are actually working very closely with CleverMed and Badgernet to pull the data sets for the 7 interventions directly out of Badgernet. So then we only have which are also routinely collected in Badgernet. So we're hopeful in the fullness of time that actually we'll be able to take away that burden, yet still be able to present that data back and celebrate it, find the opportunities that way as well. So but we're not quite there yet because the data sets in Badgernet weren't directly aligned, but that's our hope and ambition. But for now, we're still very grateful that the teams see the value in collecting the data themselves.
Fabulous. I mean, the other kind of question I had was, are all the BAPM publications freely available online? Because I know you quoted some. I know I've accessed some of these things before. But...
Yes, all the toolkits for optimization are online. Yeah.
Because I have to say to the audience, these are fantastic resources, really helpful, and really makes it, because I've gone on about this before, but neonatal care is so important as part of our midwifery role. And this does give you more confidence, because when you see these packages of information or toolkits or just articles. They are really, really helpful for making you feel more confident.
Yeah, they're really good. We Sarah and I and Karen all involved in some of their toolkits, developing them, but also they cross-reference you back to PERIPrem as well. So it works really well in terms of information.
Fabulous. Well, I should hope it would cross-reference you back, because it's a fantastic project. And I think the parents' testimony is just fantastic. Sorry, you want to say something, Ellie?
Well, only that very recently, so not only are the Bachman toolkits completely free and available via the excellent Bachman website, but in terms of the PERIPrem website, which I think was the link shared, we've just also developed a document which is sort of the first downloadable resource, which tells you our journey of how we implemented.
Oh, okay.
But also in doing so, it links in at every stage all the resources that we've developed as a hyperlink. So we hope it really is a kind of a lift and shift document. So if you were keen, if anyone is keen to adopt PERIPrem as we have, then that should really kind of help you, support you, hold your hand through that process, and link to all the resources in the sensible and chronological order that they appear. So please do check it out, because we're really proud of it.
Fantastic, Ellie. Thank you so much to Anne and Ellie.